good afternoon, and a very warm welcome to this opening ceremony for Alnylam's new site here in Maidenhead. My name is Alex Leather. I'm the head of Europe and Canada for Alnylam, and I'll just take a couple of minutes to kick off today's program. So this is a really important milestone for Alnylam as a company, and we also think it's significant for research, for the UK, and for Maidenhead as a location. And we're really pleased to have that so many of you from our new community could join us today for this conversation and for this program and to meet each other. In fact, one of the main reasons why we chose Maidenhead as our location for this site is the people. Both the network of external collaborators and partners such as yourself, but also the talent that the innovation in this area attracts. Thanks to this talent and thanks to you, this site is going to play a pivotal role in helping Alnylam build to become a global organization. We're also proud to be contributing to the UK biotech community and industry, an industry that plays an important role in bringing innovation to society. And again, we believe that the UK has historically appreciated and provided a favorable environment for this kind of science and innovation, and will continue to do so. Now, one guest who unfortunately couldn't make it today was the Right Honourable Theresa May MP. She kindly wrote us a letter, though, and maybe just share a few quick points. She wants to warmly welcome Alnylam to the Maidenhead area, strongly welcoming the investment in Maidenhead and the jobs that will come with such investment, sharing our belief that Maidenhead is a fantastic place to work and important to continue to attract successful businesses to the town, and that this overall means another vote of confidence in the business community. So we have several distinguished guests today who have kindly agreed to share a few words during the program. Firstly, Dr. Akshay Vaishnaw, our head of R&D at Alnylam. Looking forward to hearing some further content and background on how we ended up here and where we're heading. We have the Mayor of the Royal Borough of Windsor and Maidenhead, Councillor Mrs. Sayonara Luxton. Thank you for coming. Mr. Luke Pembroke, who will bring a patient's perspective. Mr. Steve Bates, CEO of the Bioindustry Association. Thank you. And then finally, Brendan Martin, our GM of Alnylam UK and Ireland, will wrap up this plenary session and help us move to a more informal discussion session. And after the plenary session, I hope that you'll enjoy continuing to talk to what is, I believe, a really strong Alnylam team, understanding, how they are focusing their energy on helping patients and bringing value to the community. So I'd like to hand it over to Akshay to take us further in the program.
Well, good afternoon, everybody, and it's so exciting to see all of you today here in what is really a very big and exciting step for Alnylam. And this is our biggest investment outside of the US. And I just want to share over the next few minutes a little bit of our history at Alnylam, both in America and here, and how we've ended up here today. So Brendan said to me, it's going to be difficult for everyone to see the screen, and he was right. I didn't quite realize we're all going to be so cramped, but it doesn't matter. If you can see the screen, that's fine. If you can't, don't worry. Alnylam, for those of you that are new to it, just a little bit of background. It's a biotech company based in Cambridge, Massachusetts in the United States. We were founded in 2002. And our vision and mission singularly has always been the same, and it's written here. It's harnessing a revolution in biology for human health. And the revolution specifically that we refer to is the science of RNA interference, or RNAi. And at the bottom of this slide, we emphasize always the way we want to do our work. And that is with commitment to people, with transparency, with focus on science. And I really want to emphasize that. I'm going to share some of our science with you. And also to work with passion and urgency. And those values I want to come back to right at the end. Now, it's particularly appropriate that we're here today because we're at the 10th anniversary for the Nobel Prize for RNA interference, or RNAi. And what you see here are Drs. Farr and Mello, the discoverers of RNAi, who originally observed it in worms, and subsequently our founders, Phil Sharp, Phil Zamor, Bartel, and Tuschl, observed RNAi occurring in human cells, and that led to the founding of Alnylam in 2002. Now, such an illustrious thing as a Nobel Prize promises great things, but translating RNAi from worms and human cells in a petri dish to where we are today has been an extraordinary journey. And that journey took us a long time and a lot of work in our laboratories back in Cambridge in the United States and with other academic collaborators. But ultimately, by around 2012, we were ready to begin testing RNAi in humans in earnest. And I just want to pause here to say, we had a big choice to make at that time. Here was a powerful technology that allowed you to take a small RNA species, and we don't need to get into the technicalities of it, but effectively introduce it into the human body. And that RNA species had the possibility to silence a single gene out of 20,000 in the human body. And that we should attempt to measure that silencing activity by looking at reduction in the level of a protein in the blood. And if we could do that, we could start thinking about a fascinating and powerful way to treat human disease. And that was the possibility that opened up after all the work we'd done at Alnylam up to 2012. But where to test that possibility? And, of course, Sarah, who's here today, who's our head of regulatory, Jeff Sahelski, at that time, even Alnylam US was a very small group. It's hard to believe, but we were. And we talked about the different places we could go to test that first proof of concept experiment. And we thought about the United States. Of course, there's a rich history of life science there. We thought about various parts of Europe. We thought about Australia. In all these countries, phase 1 studies have been done before of great import. But in the end, we chose one place, and that was the United Kingdom. And of that place, we chose one location, and we started with this doctor here, Dr. Tim Mann, Professor Tim Mann. And Tim, I have to tell you, is a legend in the field of early translational work in human medicines. And Tim has done hundreds, if not thousands, of phase 1 studies. And I also want to introduce you to Malcolm Boyce, who's just standing behind the mayor there. We also went and spoke to Malcolm Boyce. And between them, they gave us extraordinary guidance and expert technical skills to think about how to safely evaluate such a powerful new modality in man. And with that collaborative work in 2012, this is the result that we got. And what we saw was the ability of RNAi to, in a dose-dependent fashion, to knock down or reduce the level of a specific protein in the human body. And as I said to you, this is the activity of one drug against one gene out of 20,000. And the fact that we could do this with such safety, with such care, and with such expert guidance was really testament to our choice to pick the UK and the expert collaborators we found in the shape of the Guy's Drug Research Unit, then to be Quintiles, and Malcolm Boyce in the Hammersmith Research Unit. And we went on from there because not only were we excited about that first drug of ours, patisiran, which is still in the clinic today, is in phase 3 now, and we're going to get the phase 3 results next year. But we made other advances that allowed us to inject our drug subcutaneously rather than intravenously. That first drug was intravenous. And so another possibility opened up with this platform technology, as we call it, that could we subcutaneously administer an RNAi therapeutic and see knockdown. And again, with Malcolm's expert help, then the Hammersmith unit, in 2013, we were able to get this result, which is really an extraordinary result in the shape of subcutaneous administration over just a brief period, giving us this dose-dependent knockdown in a target protein that's important in a terrible inherited disease called TTR amyloidosis. And so this really set our world on fire. And again, you can see the bricks of the early translation from the bench to the bedside of our science being translated to humans with work done with our illustrious UK collaborators. And of course, once we saw this result, we've been able to really significantly expand the pipeline. And we've gone on to do a significant amount of work, not just in rare and severe diseases like TTR amyloidosis that many of you would not have heard of, but also in common diseases that we've all heard of. And here is an example of one of our RNAi therapeutics being studied, in this case, with colleagues at Richmond Pharmacology, and Jörg Taubel. Is Jörg here yet today? I know no, okay, but Keith, his colleague, is here, where you can see on the right-hand side dose-dependent reduction in LDL cholesterol. That's the bad cholesterol that causes ischemic heart disease. And one of the extraordinary things about this finding is if you notice on that right-hand panel, right at the bottom, there's one injection, and that's one injection giving 6 months of reduction in LDL cholesterol of 50% or greater. There's no therapeutic in the world that can give you that today. So the possibilities of this technology started opening up by 2014 to us. And we've gone on, I would say, with the help of Jörg Taubel and the Richmond Group and others in the United Kingdom, to really flesh out the technology. And here you see a more recent example from 2015, worked with Richmond Pharmacology, looking at a drug called NNCC5 for complement-mediated disease. And again, you're seeing dose-dependent reductions in a target protein, one specific protein, C5 in this case. But the interesting thing to note is one injection is able to ablate. It's able to get rid of a pathogenic bad protein in the body. I mean, these are really remarkable observations for this technology. And again, the importance of the UK cannot be emphasized enough in helping us accomplish this work. But I don't want to turn this into a science lecture. I do want to just leave you with one last slide on data, because this slide really brings everything together for me. It brings together our science, it brings together the power of what we can do in human disease, and it brings together possibly one of the most exciting results we've had at Alnylam in the last few years, and this was done in the UK. And what you're looking at here is a drug, it's a composite slide of several data points on a single patient for a drug that we call fitusiran that targets a protein called AT3. Now, it's a complicated story from a science perspective, but let's all just step back a minute. Hemophilia is a disease, as you all know, where there's a protein missing in the body, factor VIII or factor IX, that leads to a profound bleeding predisposition. This starts in children and goes on into adulthood. These bleeds can have profound consequences for the lives of sufferers with hemophilia, as we all know. Our hypothesis was that if we reduce antithrombin, or AT3, and on this slide here, that's the blue circles, we should be able to increase the generation of thrombin. Antithrombin has a negative effect on thrombin, so if we reduce AT3, we should be able to generate more thrombin. And that's exactly what you're looking at here, that in the blue circles, as the antithrombin goes down, the thrombin in the maroon circles goes up. But most importantly, look at what happens to the bleeds. And the bleeds are shown in the triangles at the bottom. And you can see that as the thrombin goes up, the bleeding stops in this patient, a UK patient. We don't know their identity, but we know they're here in the UK. And what you're looking at is a period of almost 3 months where this patient is bleed-free. And we've gone on to build on this work and replicate it in other results. And we now know that we're on the verge of starting phase 3 with a therapy for hemophilia patients that will allow them to have a once-a-month subcutaneous therapeutic, which would, we hope, radically transform their lives and improve not just the quality of their lives, but also improve the management of their bleeds. This is all through the work with colleagues in the UK. And I just, again, want to, in terms of giving shout-outs and call-outs to colleagues in the UK, I do want to mention Tim, because this project has required a lot of courage. And when you bring a new technology like RNAi, like monoclonals 20, 30 years ago, to bring that to humans and to test it requires remarkable courage to test that innovation in human beings. And it needs extreme care, and it needs extreme scientific insight, and it needs the willingness to innovate. And I remember talking to Tim about this project when this was just a kind of little twinkle in our eye in 2011. And Tim's smiling now, and I said, Tim, you think we can do this? And he said, well, I think we've got to find a way, because this hypothesis is just too important not to test. And so here we are today on the verge of phase 3, Tim. And I'm delighted to say that all our collaborators have allowed us to progress this technology from 2012 to the pipeline that you see today, and the pipeline shown on this chart. We have 10 drugs in the clinic, folks. It's just a remarkable amount of progress for this company. And the drugs are scattered across 3 therapeutic areas. We go, as I said, from the very rare diseases. We call it the genetic medicines pipeline, so-called orphan diseases. I mentioned some of them occurring in a few thousand or 10,000 patients. They're rare, but they're very severe. And we go from those diseases to the very common diseases like hypercholesterolemia and hepatitis B. Hepatitis B has 300 million sufferers around the world. So think of the power of this technology and think about the role that the UK has played in helping us get here. And in closing, I just want to say a few things. So why UK and why Maidenhead? I think Alex started the ball rolling and talked about the life science base and the talent. I've shown you what that talent has helped us do. It started off with many of you, our contract research organization colleagues and academic colleagues. It continues to this day, and we continue to exploit it further. But now, the most exciting thing is we, Alnylam, have many Alnylam colleagues here in the UK, in this office, and we intend to build on a tremendous nucleus of colleagues who've shown to us as I said, those cultural attributes that are so important to us: science, passion, and urgency. And we're finding that in, I think, we have 13 colleagues here today? We're delighted to have all of you as colleagues. We want to build on this site, and we hope, as we get to this Alnylam 2020 goal of 3 drugs approved and serving patients around the world by 2020, we hope to build this site to over 100 colleagues at this site. So it's really been a remarkable journey for Alnylam. It's been a wonderful journey for me personally. As some of you can hear, I grew up, I didn't get this accent in America. I grew up here, I trained here, and so it's just a wonderful closure of that circle to bring this technology back to the UK and help make the progress with all of you that we've seen today. So with that, I'll stop and invite, are we going to invite Luke or Brendan? Oh, the man. Okay, thank you.
Well, good afternoon, everyone. I'm delighted to have the opportunity to personally welcome everyone at Alnylam Pharmaceuticals to the UK, and in particular to the Royal Borough of Windsor and Maidenhead. I'm thrilled that an innovative company like Alnylam have chosen to settle in Maidenhead. I'm sure they will add to the economic activities of the area and create high-value jobs. We have lots of residents here who would be really happy to have this company here where they will earn a living. Maidenhead offers excellent national and international links within easy reach and has good access to London and Heathrow and Gatwick. There is a wide pool of talented people in the area, with the critical mass of biopharmaceutical and service companies within reasonable traveling distance. Biomedical science is so important in pushing back the frontiers of medicine so we can conquer disease and bring hope to patients and families where previously there were none. And Alnylam are engaging with research and medical communities to tackle really difficult and distressing disease through cutting-edge medicine, and we are lucky to have a world-leading and well-trained talent from our prominent biomedical universities and hospitals. We have just heard from Dr. Ashe, Alnylam Chief Medical Officer and a UK-trained doctor who has worked in the US biopharmaceutical industry. He has led a team for over a decade to take Nobel Prize-winning basic medical research and work to turn it into real treatments that attempt to change life in a truly profound way. We are indebted to those who have foresight and care that our researchers and doctors have, and it is very important that we recognize and strengthen these companies in the UK. I wish you all the best, every success in Maidenhead, and look forward to following progress and due course, and welcome all of you in our community and all the events that take place in Maidenhead and within our borough. Well, thank you very much.
Not bad ankles for a haemophiliac, you see that. Yeah, I haven't really sort of prepared anything formal. I was told not to do slides. I think I've got about 15 minutes. I'm not sure if all of you have been told prior to me being here, but I was actually lucky enough to intern for Alnylam, which I remember avoiding saying the name for a while before I turned up. I remember looking at the name being like, how on earth do you say it? Is it Alnylam? And so when I turned up first day on my internship, I was like, don't say the name, wait for someone else to say it. And then I clocked it from there, but yeah. I found that one a hard one to get my head around. But yeah, I did a 3-month internship, and I didn't just work on haemophilia, which was really interesting to sort of see the entire pipeline at that time, which it's already changed a fair bit now based on what I saw on the slides. But of course, I did really like to give my input into the haemophilia side of things. So I am a severe haemophilia B patient, and I have no family history. My mum wasn't a carrier, which is usually how it's passed on through the family. although I think it's actually a third of cases are spontaneous mutations anyway. So that's still quite a lot when you think about the small amount of patients there are, and some of them no family history at all. So you obviously have a lot of parents who don't have a clue about the condition. And so when I heard about this new potential drug coming through, I was like, oh, this is exciting. Molecule, we won't call it a drug yet. I don't know what the terms you can say early on. But I was like, oh, that's interesting. And I really wanted to sort of find out a bit more about it. So I spoke to Benny Sorensen. If those of you have heard of him, just absolute encyclopedic knowledge of haemophilia. And I met him when I was 15 at St Thomas's Haemophilia Centre in London. And he let me come into the lab. And I think he was doing some research back then for the NHS, it might have been, and he showed me how they test my blood. But for a 15-year-old, when they take your red blood, put it in a centrifuge, and you're like, well, it's not red anymore. I was amazed. So from that point on, sort of the biomedical side of things was always something I was interested in. So I went to university and did biology. Didn't end up being the next David Attenborough because I decided animals and all that stuff wasn't very interesting. I got more into the sort of pharmaceutical development side of things, which is where my main interests lie. And so when I was over in the States, which was my first time out there, and Boston or Cambridge is an interesting one because I found that the people were potentially as miserable on public transport as Londoners. So it didn't really feel that different when I was commuting into work. But yeah, I met some great people when I was there. I met Akshay, and I got to meet my boss at the time, Tim Mooney, who sort of hadn't been in pharma before, and he came in, he just had this overwhelming knowledge of haemophilia, and it was really sort of humbling to meet the people working at Alnylam who'd really sort of put the time and effort into research the condition and understand a lot about it. And I'll put it quite colloquially, but everyone at Alnylam I found were nerdy, who were really nerdy people, like loved the science, really got down to the nitty-gritty science of it, but all really good at communicating the science, which I think's going to be very important with such a revolutionary platform for making a wide range of drugs, not just in haemophilia. But yeah, it was interesting when I was there. I'm sort of just giving random stories now, but when I was there, I actually had a bleed, and my ankle just started flaring up, and my target joint has always been my left ankle, so I've got some degenerative joint disease, and that's just from probably being a bit of an idiot when I was younger and doing stuff I probably shouldn't have been doing, mainly football, those sorts of things. But yeah, I was sat there in a meeting and I started having an ankle bleed. And this is the thing, it just shows with haemophilia, it can just come on. It doesn't have to have been a reason. The spontaneous bleeds can be just as much of a problem, which is why priority, stop the spontaneous bleeds. Then sometimes haemophiliacs are like any other people, they're going to be risk adverse and you're going to end up having an accident, but take your treatment and you'll be fine. But yeah, I was having this bleed and I remember sitting there like, oh no, I'm actually having a bleed. What do I do? I don't want to. I'm an intern. I can't take days off, especially in America as well. I'm pretty sure you're not allowed to be ill over there. So, and so I was wincing, and then I got up and I couldn't really walk at all, and I sort of hobbled back to my desk, and everyone was like, "Is everything okay?" And I was like, "I'm having a bleed, so I need to go home." And they were like, everyone like around me just sort of like freaked almost. They were like, "Are you okay? Oh, we can get you a cab, this, that, and the other." And it was these people who'd been like working so involved in the science and like haemophilia, it's a rare condition, let's find a new treatment for it, let's see what we can do, it'll be great. But then when you actually see the patient and someone actually having a bleed, it's sort of the real world impact of it. So if anything, maybe it was a good thing I had a bleed at work. But yeah, it was a fantastic experience. And then I came back and I kept in touch with everyone. I recently attended WFH with the Haemophilia Society UK. Heavily involved with them as a patient advocate, sort of really think patient empowerment and demanding sounds a bit pushy, but really sort of striving to get the best treatment does to some extent now land on the patient's shoulders. I think especially in the UK you sort of need, well, now we've left the EU, hopefully we'll get stuff on time, but it's sort of really important that patients understand their condition. And I've always like interested in the science side of things, so I can sort of see new stuff coming through and try and make my judgment on it. And I've only got a BSc, but I feel like I understand it enough to like sort of keep my interest in it. But then there's obviously a load of patient advocates who aren't sort of scientists by trade, and sort of communicating a new technology to them like this is going to be a massive challenge. But I think it's really exciting stuff, and everyone I've encountered at Alnylam have always been very supportive of me. They almost don't like see me as a patient. It was just like another colleague, and they were interested to hear what I had to say. They gave me the opportunity to get up and give a talk similar to this. Well, there's a lot more people, and they got pizza in. So I feel like maybe we've been let down on that side. But it was a fantastic opportunity, and I loved every second of it. And from the patient advocate side, selfish haemophiliac, there's potentially stuff in the future. For me, it's really exciting, but just in terms of like the science, it is something completely different, and exciting that it's now in people. Sort of time will tell how it goes, but it's crazy to think it was 2014, I was over in Boston, and now just over 2 years later, there's going to be several hundred people working for Alnylam in the UK. And I think it's sort of a testament to how successful things are going, and really looking forward to seeing what's going to happen in the future. It means a lot to patients out there of rare diseases that new stuff is being developed, and sort of it's not progress for the sake of progress anymore, like really sort of finding a need with this platform that you've got. You can see the possibilities are endless, but you've got this amazing technology, but trying to identify what are the main things we need to tackle with this is going to be the big question. I'm personally glad one of them is haemophilia. That'd be great. And it's odd to think that since I've been born, I'm lucky enough to have factor replacement therapy, but it's not factor replacement therapy anymore. It's this sort of new age of pharmaceuticals. But it keeps things interesting, and hopefully it all goes well. I always keep my eye on the data, which is another thing Alnylam's great at. You get to see all the data online. Everything's put out there for you. If you want to understand it, you can go understand it. The data's out there, read it all, and it's all very interesting. But yeah, I hope you all enjoy working for Alnylam in the UK. It's a very nice office, and it was actually quicker for me to get from my job today in central London to here than it is for me to supposedly commute home to still within London. So no one quite really knows what London is. It's just this massive, miserable, angry commuters. Sometimes you get home and it's fine, but yeah, commuting on a bleed isn't the most fun thing, but I've luckily not had too many of those frequently. But yeah, thanks for letting me talk. A load of rubbish. Hopefully it was insightful, and yeah, best of luck, guys. I'm sure it's going to be an exciting few years. Bring on 2020.
Well, how'd you follow that? Yeah. Thanks. That was fantastic. So I'm Steve Bates. I'm the Chief Executive of the Bioindustry Association, and I suppose my role today is to do the national welcome to Alnylam. I'm delighted that you've got the letter from the Prime Minister, which is fantastic and shows your already influence in the community. And I always think of these events a bit like family dues. You go to weddings or you go to christenings. And I think it was always interesting at family do to understand the connections that you've got and the connections that you have. And I think as you discover during a get-together how you know each other or the connections, it's always interesting. And I think with Alnylam, I think you can see that there are fantastic connections into the UK community already, largely through the clinical development work that's been going on for a number of years, and from the people that you've got now in the team here. Brendan, I know well from my days at Genzyme. You've got other colleagues here who've been in the UK biotech scene through Cambridge Antibody Technologies and others, which are famous names in our sector. And it's great to see your engagement with some of our fantastic clinical investigators, which is really the bedrock, I think, as you said, Shay, on which the bioscience sector is based. If I can, I'm going to take Luke's point about commuting and try and put it in the context of bioscience. Here, Brendan and Alex have wisely chosen to be a stone's throw away from Maidenhead Station, which not only is the Prime Minister's constituency, but is going to be on the new Crossrail route, so it'll be even easier to commute in and out, and no doubt get incredibly busy in a few years' time. But in a sense, that is a 21st century add-on to essentially a 19th century piece of innovation. The Great Western Railway, a fantastic, one of the first most important railways in the world for high-speed trains. And it's taken the UK probably nearly 200 years to update it. If you looked at the innovation that's gone on in bioscience, really in my lifetime, it is going at such an exponential speed, it's really hard to see. I think people understand the internet has changed the world in our generation, but it's harder with the stuff that's going on inside bodies and inside labs because it doesn't come out as an iPhone. And in some senses, I don't think people have quite noticed the scale or the revolutionary nature of which things are changing. And if you look at the treatment with technologies such as that you're progressing, or the antibody technologies that preceded it, these really are making revolutionary steps in bioscience. And I think we'll only see it in perspective. But I think if you think of the work that Alnylam are doing, the work that you're doing here is as important this century as the bricks and mortar of the bridge and the railway that was there a generation ago. I think this is the stuff they will write about in our era in the history books. And okay, it's complicated, and okay, companies always have difficult names, and the drugs are even more difficult to name. But this is the stuff that will make a difference. And what I'm really pleased about is if you think about Alnylam as a company coming from world-class science, Nobel-leading science, I think this is a wedding, not a christening, because you don't get married or you don't have a wedding when you're a child. And Alnylam has gone through the development stages, which is a period of time. It does take time to develop the science, is growing up, and has come to the point now where really serious translation of that fundamental science into patient benefit is about to take place. And I think that that's what's really, really important. So I think you've gone through that stage. There is a real maturity to this business. To mix my analogies, we're lucky in the UK now sometimes to have big American organisations that we've heard of come over. And if you go to Wembley or Twickenham in the next few weeks, you get to see the American football. And people may have heard of, I don't know, it's the Boston, who plays in Boston? The New England Patriots. If the New England Patriots moved into Maidenhead, I think people say, oh yeah, Alnylam are the sort of equivalent. They are, in terms of one of the 4 or 5 really big biotech companies that are in Boston. So this is Premier League, NFL-style companies, and it can be hard to put this into context. And you can talk about numbers and put billions, but I look at the companies that are out there. Alnylam really are one of the real leaders in the Cambridge, Massachusetts, Boston area. Really, really, really exciting, fundamentally exciting technology. And I think that you should think about it almost at that scale. That's the type of organisation that you've got here. The other thing is, I think we should just thank Alnylam for coming. They could choose anywhere in the world. Literally, you guys get on planes, you start there, you think global. And what's fantastic for me is that you've understood and you can see what I hope we truly have in the UK, which is that fundamental commitment to science, investment in that both from government. I think you have a society that's open to it. I think the patient community here are fantastic. They're organised. The groups that you've worked with. That is a real powerhouse. The charity community and others. Allied that to a healthcare system, which for all its challenges is committed to trying to do translational medicine. It is difficult. It is tough, and it's difficult particularly when there's not much money going around and there's lots of pressures. But I think that fundamental excellence, and it allies to the values that you so closely articulated, I hope is the reason why you chose the UK, and I can see why you chose Maidenhead in particular. So from my perspective, welcome. It's fantastic that you're here. The thing that I'm really keen that I want to work with you guys on, I think we can offer with my colleague Cristiano Bizet particularly, is there's some new rules to the game as to how drugs are being developed and the rules by which they're regulated and how you can get them to patients more quickly. These are things like the Early Access to Medicine Scheme, the Priority Review of Innovative Medicines, technical stuff, but it's basically how do you get them from being an investigational drug into patients. And there's some new rules and some new ways of doing that, which I think innovative companies who are ahead on their science and are prepared to think in a new way have the opportunity to both speed up the process and make things happen more quickly. And I hope that we can be a useful partner for you, particularly in that area, which I think is almost the stage of development that you're at, where we can help you with that on a European level. Beyond that, I just want to say thank you, welcome, and look forward to working with you. Thank you.
Simon Dudley to say a few words as leader of the council on behalf of the council.
Well, I'm going to make this very brief. There's been some excellent speeches already today. It's wonderful to have Alnylam here, and I think I've nailed that, actually. I was very concerned practicing that before I came over, but now I'm just going with the phonetics, and it works perfectly. Look, you're a high-growth global company. You didn't need to come to the UK. You didn't need to come to Maidenhead. So we are truly blessed that you have come here. I know Theresa May, the Prime Minister, was here. I think she's in the United States today. She would be absolutely delighted that you have come to her constituency, not only for her constituency, but also because of the confidence that that shows in the United Kingdom for such an important future business globally. So, you know, we have high ambitions for Maidenhead. It's a wonderful place. We've got fantastic transport links coming with Crossrail at the end of 2019. We've got 2 world-class airports which are close. I've already been tweeted by back Heathrow, who are trying to politicise this, but you've got Heathrow here, we've got Gatwick close as well. We are delighted you are here. We're going to be developing 150 acres in Maidenhead in the town centre. Big office blocks, 120, 140,000 square feet. So as you really, really grow, we will be growing. We will be there for your future beyond 2020. 135 acres over there we'll be developing as well. So look, we've got everything that you need here. We've got a very, very high quality workforce, labour pool here as well. We're just extremely grateful that you are here, and I hope your business goes from strength to strength, which I'm sure it will. So thank you.
Good afternoon, everybody. I'm Brendan Martin, the General Manager here at the Maidenhead site. So I want to start just by welcoming you all here today. We're so pleased that you could take the time out of your busy days to come and engage with us and engage with each other. I mean, the main purpose here is to start putting faces to names and get to know each other a little bit better, and as well as celebrating the occasion that it is to turn plans and aspirations and visions into bricks and mortar and real people establishing ourselves here in Maidenhead. So you've heard many remarks about why we've chosen Maidenhead and why we've chosen the UK. But as we find our feet here over the last month or so, there are a number of things that we have noticed as employees that we're really enjoying about this space. You know, the proximity to the town centre, the practical things of being able to get to the bank and the dry cleaners during the day. It's just so much better than being in a remote business park that's out in the wilderness somewhere. We've heard about the engagement with great UK scientists. Locally, we've taken a slightly different approach to getting to know the community. We went out on a foraging day a couple of weeks ago as a group, where we had an expert forager lead us through the countryside and point out all the different fruits and herbs that were available to us. But it was the most enjoyable day and a great way to get out there and see the countryside that's around Maidenhead, and it's a beautiful part of the country, there's no doubt about it. I just wanted to take a few minutes to introduce you to our new home. It is a new building. It's a workplace that we're very, very proud of. When you're in a knowledge-based business like ours is, most of the company's assets resides in the brains and the capabilities of the employees you have. So your employees are a very precious asset, and you want to have workspaces that take the best possible care of them. So there's quite a bit of thought has gone into the layout of how people can come to work, enjoy their time at work, collaborate effectively, and go home. So I'm going to invite you in a few minutes to have a little look around the building and talk to employees, but there's a few features worth pointing out. We are a global company. We've put a lot of emphasis on the interconnectivity with our colleagues over in Boston. So we've tried to adopt a technology here that's very close to what they have over in 101 Main Street in Cambridge. So it's pretty much a seamless experience to come in here, sit down, plug in and play and start to work. We have a lot of video conference facilities. You can't jump on a plane every time you need to talk to somebody. So to try and maximize the use of modern technology to speak to colleagues across the pond is something that we've really focused on. The layout of the space is really flexible. You have people who at times will be working in project teams and at times will be working in functional areas, and we've tried to make the space as accommodating to that flexibility as possible. And we've also tried to bring as much natural light as we can into the building. All the offices and meeting rooms have glass fronts, so we have natural light coming into the building from 3 sides. What you see here today is only a quarter of the space that we've got here. We have phase 1 on the ground floor. We've also taken the whole of the 2nd floor, which is bigger than this, and the 3rd floor, which is the same size as this. Again, we've got half the space up there. So phase 1 is what you see here. It's just complete. We'll be embarking on fitting out phase 2 from January 2017. Hopefully we'll be completed by June. And I want to pay tribute to our facilities colleagues who've done such a fantastic job in thinking through the space and thinking through the environment they've created here for employees. So, as I say, the main purpose of today is to network, to engage with people, to get to know us, to get to know each other. We want to say thank you to all the strategic partners and investigators who've helped us on this journey so far. And in doing that, just announce our presence that, hey, there's real progress going on here. This is going to make a difference. So take some time, move through the building, talk to some of our colleagues, get to know each other. There will be some drinks and sweets available to have as you go along, but I want to take the next half hour to do that. And thank you all very much for joining us here today. We really, really appreciate it.